Hello.
First of all, I would like to thank Chitra ma'am and AIOS ARC for giving a young surgeon like me an opportunity to present.
By the way, he's from Prayagraj. Yes, I should have said that in the beginning. I actually started telling something else. Tell me.
So the topic is Intumescent Rhexis Made Easy. My technique which I use is the double Rhexis method, in which first I do a small Rhexis in the center and then I extend, as discussed already during Dr. R.K. Sharma's case by Chitra ma'am. Now, during the COVID season, for 1 or 2 years approximately, patients were very afraid to come to the hospitals. And post-COVID, there was a glut of patients with hypermature and intumescent cataracts. Now, this was the case which we operated, and as soon as I put a nick in the AC, suddenly this happened. Now, for a young surgeon like me, it was a very challenging thing. So soon I realized that I need to make a Rhexis perfect before, because I'm not a VR surgeon, I cannot handle any of this drop myself. So first, in the AC, I put a very high viscosity viscoelastic. The one I prefer is a 3% sodium hyaluronate. Now, by making a small Rhexis and using IA to debulk the nucleus, then I can increase the Rhexis using a micro Rhexis forceps. This gives me optimum control, and a Rhexis of approximately 5.5 to 6 mm can be achieved without any problems. This is another case in which, similar case in which I have done this. 3% sodium hyaluronate solution is used in the AC, and a small Rhexis is made in the beginning using first the nick is made in system, a culvinilium mace as already discussed before, and a small Rhexis using micro Rhexis forceps. Then, using IA, some amount of debulking is done so that the interlenticular pressure is less. This will reduce the incidence of radial tearing. Then again, the AC is filled with high viscosity viscoelastic, and the Rhexis can be extended. This is the third case, a similar case, but in this, the cortex is not at all milky and there is no fluid egress. This kind of hypermature cataracts are very dangerous because since the cortex is not milky, automatic debulking of the nucleus is not present. And this kind of cataracts can result in a lot of Rhexis runout cases. Similarly, debulking is done. You can see that debulking can be seen using IA. What I do is I press the nucleus a little bit and rotate it in the bag. This will reduce the cortical matter behind the nucleus also, and thus it is completely pressed to the posterior capsule. Now Rhexis is extended using a micro Rhexis forceps. Now, in spite of all these efforts, sometimes the case may run out. And in this case, due to not having micro Rhexis forceps, I was using Haldi Poker's Rhexis forceps. Trying to make a small Rhexis in the beginning, but as you can see, because I don't have a micro Rhexis forceps, some amount of viscoelastic is leaking out from the port, and this resulted in the Rhexis kept running out, and I was not able to salvage it in the beginning. To reduce the interventricular pressure on this side, I make a small cut on the opposite side. Thus, it will prevent running out of the Rhexis from the side of the runout. Now, I have to make the Rhexis as round as possible. So a small nick here and making it round. By this time, my assistant brought me the micro Rhexis forceps. And I could now make something similar to like a Rhexis, but with 2 runouts. In this case, I have to bring the nucleus in the AC and complete the case, just like Dr. R.K. Sharma.
Dr. Ankit, that was a truly wonderful video which you showed. The consistent, really needs a clap. Consistent, nice round rhexis and doing multi-quadrant IA so that you're totally debulking the soft cortex out and then going on to extending the rhexis to a beautiful, each video after the other was a teaching video. And the last thing which you showed was also an excellent learning tip, is the making an extra nick, because that would prevent the wraparound rhexis tear happening, and how you converted into what near normal round and completed it. I do not have any questions. I just wanted to extol what you did so well. Mohan Rajan, Dr. Malay, Dr. Manisha,
Ankit, I think Chitra, you reserve the best for the last.
Yeah.
Ankit, beautiful videos.
Yes.
What is important is, I think you have done the small rhexis, but after the small rhexis, this is what I'm trying to tell everybody, that please understand that when you do an irrigation aspiration, it is not only the front compartment, but also the back compartment. The back compartment also has to be decompressed. The back compartment that's why you are rotating the nucleus, and the fluid from behind the nucleus is also coming off.
Yes.
Okay. So that also prevents the Argentina flag sign. Wonderfully done. Lovely videos. Really kudos to you.
Yeah.
Thank you, sir. Thank you so much.
In fact, I think it has been any other comment from anybody else before we conclude? I think we have